Hello people, in this video let us look at splenectomy. That is, we are going to remove the spleen and discard it. So here's the spleen. There's only one spleen that you have. It's on the left side, and spleen has two E's. Well, splenectomy has only one E. Well, let's continue. What are the indications? When will you do splenectomy? You want to take the splenectomy and remove it. Why will you do it? Because we are reading surgery. So basically we are reading surgery topics. So why will you do splenectomy? Always indicated. Always you have to do splenectomy. Primary splenic tumor. There's a tumor. Remove it. Hereditary spherocytosis. Spherocytosis means instead of the RBC being like that donut, cute donut, instead of RBC being like a cute donut, it will be like a spear. And what will happen? It will get stuck in the spleen and get destroyed. So the people will have hemolysis, anemia. So remove the spleen. Who's the problem? RBC. The shape of the RBC, but poor spleen got removed. Okay. So you understood the two always indicated indications of splenectomy. As a surgeon, say, come on, I will remove the spleen. Yes. When there is hereditary spherocytosis. Yes. The other one, when there is splenic tumor, primary splenic tumor. Very good. Now, usually indicated. Everything else is for us usual only. Okay. This entire thing list we'll by heart. No, we'll learn. So, let us say, what and all we'll understand. Yes. Splenic injury, if it is there, there's splenic abscess, splenic vein thrombosis, hypersplenism. See this hyper. This is not biper. Hypersplenism. Okay. Hypersplenism means it's overactive spleen. It is just so overacting, it will destroy all the red blood cells, WBC, everything prematurely it will destroy. So remove the spleen. Okay. So this we can understand, isn't it? Hypersplenism, we can understand. We can understand splenic abscess, some injury we want to remove. Okay. Then idiopathic thrombocytic purpura. Thrombocyte means what? Not enough platelets. Platelets are getting destroyed by spleen. They'll remove the spleen. Very good. Then all these are only partial, sometimes indicated. So don't worry so much. Okay, we'll just tell you here and there. This much we understood, right? Splenic vein thrombosis, something to do with the spleen itself. Then coming to this one, autoimmune hemolytic disease. These people are already destroying their blood cells because of autoimmune. Then we don't need spleen. Kind of makes sense. Then hemolysis. Wherever hemolysis is happening for whatever reason, at least stop the spleen from doing hemolysis. Correct. Again hemolysis here. Just remove the spleen. Enjoy life. Hodgkin's disease with anemia. See, these people have anemia. They want some more RBCs. They want it to live for longer. We'll give them. Yes, we'll remove the spleen. Thrombocytopenic purpura. How's it going, people? Thrombocytopenic purpura. Name itself tell you. There's thrombocytopenia. So, thrombocytopenic purpura. Less platelets. Remove the spleen. Then, splenic artery aneurysm. Here it was splenic vein. Now here it's splenic artery. Wiskott-Aldrich syndrome. What is this? Wiskott-Aldrich syndrome. This is basically, they have thrombocytopenia, guys. So we'll just remember this much. Spleen destroys platelets, so they'll remove the spleen. Thrombocytopenia they will have. Okay. Then, Gaucher's disease. What's the problem in Gaucher's disease? There's buildup of fatty substances in the certain organs like spleen. Buildup of fatty substances in spleen. This was what we'll remember. So there is fatty substances in spleen. So we'll remove the spleen, no? Yeah. Which is the only thing we didn't cover. Thrombocytopenia is there. So you'll remove. This we understood. What is this myelofibrosis? Something to do with the bone marrow. So bone marrow itself is not proper. So who will make the blood cells, right? So obviously remove the spleen. So this is also clear. Bone marrow has issues. So who is there to produce? If nobody is there to produce, at least stop the destruction. Makes sense. So we have understood the indications of splenectomy. Did you understand? You will be able to write in the exam, right? Here and there some causes. Now look at this. There is total splenectomy. There is partial splenectomy. Partial splenectomy, part of it removed. And down here you have the splenography. They're just suturing it. Okay, they want to preserve the spleen. So basically, they are treating all this. Okay. Okay, so whenever there's trauma, right, you should be very actively doing a splenectomy. Active bleeding with hypotension. If it is there, like due to large lacerations, this trauma, remember, trauma, T-R-A-U-M-E. You have to do splenectomy, emergency splenectomy. Just like how that appendicitis comes with emergency, right? This is another emergency condition, looks like. Active bleeding with hypotension, okay? And what is the treatment? Emergency splenectomy. Yes, it's the treatment. It is quick, easy to perform, and can be life-saving. This is what we want to know. Life-saving, okay? Now, let's go here. How will you do it? So, they will ligate the splenic artery. Obviously, it doesn't need any more blood supply. You are going to remove it. So, ligate the splenic artery. Whoever is supplying blood, ligate them. First at the upper border of the pancreas, followed by the splenic vein. First, we'll do the artery, then we will ligate the splenic vein. We got it. Okay? And you want to know where the splenic artery is. So, look at this. Here's the spleen and here's the splenic artery. And here's the pancreas. So, they said the upper border of pancreas, there somewhere you will ligate this, right? So, did you get it, people? The splenic artery is ligated first at the upper border of pancreas, followed by the splenic vein. And in desperate situations, the spleen is mobilized by incising the iliorenal ligament. Something is wrong with the spelling, isn't it? This is correct spelling only. What they are saying is this iliorenal is nothing but splenorenal. Okay. So they will just go through they will incise the splenorenal ligament and they'll clamp the artery. Large arterial clamp is applied at the splenic hilum and splenic hilum, and the splenectomy is done. So where is the splenic hilum now? See here. This is the splenic hilum. They'll just, entire thing they will just catch with that clamp and remove the spleen. Splenectomy is done. Okay, this is the emergency one. Fine, you got it. So in this video, you just wanted to look at what splenectomy, when you will do it. The absolute indications are splenic tumor, primary splenic tumor, and hereditary spherocytosis. Most importantly, everything else is not absolute indication. You have total, you can remove splenectomy, you can do partial, you can do splenography, etc. Basically, emergency splenectomy, what will you do? It could be a life-saving procedure if there's active bleeding with hypotension. So basically, it could, how will you do? You will ligate the splenic artery at the upper border at the pancreas and then the splenic vein, and then you will do the splenectomy. If it is a very desperate situation, then you will just go through the splenorenal ligament and you will put a large arterial clamp at the splenic hilum, and then you will do splenectomy. Okay. This is how you do emergency splenectomy. Hope you understood. Bye bye.